Longevity has different meanings to different people. For some people right now, it's about this quest to live to 120 or 150. It's really about having my healthiest years be still to come.
We are at an incredible inflection point in human history where we have the opportunity to help people understand their bodies with WHOOP Advanced Labs.
The total picture is what's so powerful. We talk about longevity a lot, but what we really mean is how do you preserve the function and capabilities that we enjoy in younger life.
The unlock is when you don't just look at numbers in a silo, but you start connecting the dots across the body. As this lab data becomes more and more available to people everywhere, I think is going to have really important implications for people who care about their own personal health.
We have such a special episode today. We have the opportunity to talk to two of the world-leading experts in longevity science, Dr. Robin Berzin and Dr. Dan Henderson. We are at, I think, an incredible inflection point in human history where we have the opportunity to merge two extremely exciting data sets to help people understand their bodies with more fidelity. And I think, when we zoom out and think about our mission here at WHOOP, it's really to unlock human performance and health. I think we have this opportunity to go just even a layer deeper when we introduce labs. So we're going to talk about what that means and really dig into your perspectives on what are the opportunities for our members in terms of understanding their bodies better. And maybe we can start just by kind of defining what is longevity. Robin, why don't you start?
We were talking about this earlier, and longevity, I think, has different meanings to different people. I think for some people right now, it's about this quest to live to 120 or 150. And I'm like, I don't know who's going to be there giving you a pat on the back when you get there, but good for you. I think for me as a parent and as a mom, it's really about having my healthiest years be still to come. And it's not necessarily about being healthier than somebody else when I'm 100, but it's about what does my next decade look like and the decade after that? And can I be an active participant in my kids' lives? And can I be still living the story of my own life? And can I look and feel the way I want to for that story?
I follow you on Instagram, and you're just a beautiful role model in so many ways for those of us striving to live long, healthy lives. So just deeply appreciate the education that you provide. What about for you, Dan? What's your perspective?
Yeah, it is a little bit of a misnomer. My epi professor, who was Dutch, he would say longevity, but it really means more about how long you live. But most people, when they really think about what they really, really want, it's not to be 150, especially if the last 5, 10, 15, or even 20 years, if we're talking about 150, are really not that fun. So I do think that we talk about longevity a lot, but what we really mean is the quality, is the health span. And people who are in the longevity medicine community, which is, I think, still somewhat nascent and evolving, so there's a lot of people who are probably part of it, even though they might not identify. Nobody is trying to figure out how to keep somebody alive at any cost to 160 or 200. It's really all about how do you preserve the function and capabilities that we enjoy in younger life. And I think whenever you're trying to achieve a goal, you have to have good measures. So part of that is deciding what matters most at each decade. And it's a lot of the stuff that you just mentioned, I think.
Yeah, well, in terms of what matters, what gets you most excited about the biomarkers that we'll be tracking? And what are the biometrics that you think are also really exciting inside WHOOP?
I mean, I'm a health dork, so it's all so exciting, okay? When I was in my medical training, I was constantly told not to over-test. Like there was this big fear of over-testing. And I looked at the vast majority of the people who were in the hospital when I was in, that part of my training. And I said, well, most of these people would have really benefited from more testing if we had gotten to them earlier on and helped prevent the late stage endpoints of diseases like diabetes and heart disease, dementia, even autoimmune, or even women in their 40s and 30s experiencing fertility issues. If we had gotten ahead of some of those reasons, we could have done something about it. Yeah. And as far as I could tell, and some back of the napkin math I did, the little we would spend on more blood work earlier on would save us hundreds of millions, probably billions, possibly trillions of dollars, because it would shift the health trajectory that people are on. So I get really excited about measuring longevity, and I get excited about biomarkers. In my practice, partially it's functional medicine. So for a long, long time, for a decade almost now, which is crazy, we've been doing advanced testing, more data, more biomarkers, and trying to understand the whole picture of your body. And I think the unlock is when you don't just look at numbers in a silo, but you start connecting the dots across the body. Sometimes people's brain fog starts in their gut. And so we need to understand the whole of you if we're going to really shift the trajectory of your health.
Yeah. What markers really stand out? Both of you see a lot of patterns, right, with patients, and you see lots and lots of data. Are there any markers that really bubble up and are really indicative of someone's kind of overall health? What do you really focus in on?
Yeah, absolutely. I mean, there's so many, right? But I think a couple that stand out are fasting insulin, right? Let's not wait till your A1C is through the roof to declare that you have diabetes, right? Let's look at fasting insulin to see how your metabolic health is trending. Another one I think about a lot is, especially for women, thyroid markers. 1 in 5 women in her lifetime will be diagnosed with a thyroid condition, and it goes missed all the time. I can't tell you how many patients have come to me, put on an antidepressant or put on a weight loss med when no one properly tested their thyroid. So that's one I see all the time. Wow. And then, in the world I'm in, there's few people who are truly nutrient deficient, but there's a lot of people who are nutrient suboptimized for how they want to feel, from things like vitamin D to magnesium. And you can use those types of markers and really, really easy, cheap interventions to really change how somebody feels. And so sometimes it's the marker like fasting insulin that's getting ahead of a serious illness like diabetes. And sometimes it's a marker that just helps us feel better right now.
Yeah. And I just think these little tweaks, they go a long way. Yeah. We don't have to feel meh. There is a better path. And I think that's what this is going to really help accelerate our wisdom. What about you, Dan? What markers are you really excited about, and what gets you going on the Whoop platform?
As an internist, a doctor who thinks about the complicated systems inside people's bodies and outside them that, produce all this behavior we call health and wellness, it's hard to pick. A lot of these are really cool. I experience the same tension as a professional and in my, medical practice community about what's the right amount of testing, and, being careful not to do tests that people don't want and aren't going to learn from or aren't ready for, but not shying away from learning. When you're a doctor, your job really is to make sure that you're avoiding sort of easily avoidable disease in a short term, and that you're diagnosing everything that's present. So I feel like if a patient comes into my office and I do a good job, I'm expected that they're not going to have a heart attack in 5 or maybe 10 years. But that's about kind of the job. I'm not really supposed to think about every possible thing the way I would for myself or my wife or my mom or, anybody where I'm sort of more invested. But of course, that's how we all feel about it. And so when you give individuals this level of information, they can really take hold of it more than health professionals would. And so I very much agree that the insulin and the glucose and the HOMA, I think diagnosing metabolic, suboptimality, whether it's prediabetes or diabetes or what I sometimes...
Pre-diabetes.
Exactly, yeah. I think that that's huge. Yeah, and we are starting to understand more and more that even irrespective of other risk factors, that much insulin running around in the body is probably bad and probably independently causes the things we don't want, heart attacks, strokes, and the like, as well as probably a lot of the feeling meh, having trouble losing weight, not getting what we want out of certain workouts and things like that. I love that. I'm also a big fan of ApoB or apolipoprotein B. Admittedly, I'm sort of a heart health nerd. This is a test I used to only get on people who had sort of weird family history or a weird event, and I would send them to the preventive cardiologists at Mass Brigham, famous researchers, and I would sometimes get this before or after. But I love that we can check it on everyone because it is a slightly better, and I think we may learn much better measure than the sort of standard bad cholesterol or ratio that everyone's used to checking. For a lot of people, that's maybe kind of icing on the cake, but sometimes you discover these kind of jaw-dropping disparities or discrepancies where somebody actually learns a lot. A test that I hope won't matter for too many of our members, but for some will legitimately save their life is lipoprotein little a. And I actually checked that on a friend recently in the context really of kind of testing out a testing system. And he had the highest level I've ever seen in my career.
Wow.
And this is a very healthy guy. So I think that probably saved his life because, if you don't know about this, it tends to show up in your 50s or 60s as a really bad event. Again,
People will be intrigued based on what you just said.
Right. This is one of these things, I trained at Columbia where almost everyone who doesn't know that they want to do something else becomes a cardiologist. So I think about this a lot, but it is this kind of scary thing. It's an abnormal lipoprotein that's 5 or 6 times more good at generating blockages and heart attacks, and also has kind of not just a blockage function, narrowing the arteries, but also has some functionality to produce the clots that clog them up instantaneously.
What kind of lifestyle behaviors lead to that situation?
So that's a really good question. And, lifestyle is a big part of everything, but the LP little a or lipoprotein little a, there's parentheses there. It's actually mostly genetic.
Okay.
It does go up and down a bit when you check it a lot.
So this is a powerful test and really important because you can be doing everything right.
Exactly.
And this could show up as a problem.
And in fact, one of the ways that I first learned that this was really important was, I think it's Bob Harper, but a pretty famous kind of fitness celebrity, super fit, who had a massive heart attack that if he had had it in a field somewhere, he would be dead. He was lucky, he had it, I think, at a gym in New York City and was brought to a really excellent place and was on, effectively the heart bypass machine for a while. It's those kinds of people and those sorts of tragic stories that we think many are due to this. And I think giving individuals that information, and some of my friends say, why are you checking that? There's no medicines to treat that. There's actually a medicine in clinical trials, and I think a lot of us are knocking wood. And we're in a really amazing time in medical science where almost anything, it's reasonable to think if you're looking at a 10 or 20 or 30-year time frame, we'll have something for that soon.
Yeah. You both mentioned insulin at the very top of your list. Maybe let's just pause and talk a little bit about the difference between glucose, which I think people are actually more familiar with. And we live kind of in this glucose-centric paradigm. And a lot of that is because of the introduction of, just regular folks being able to wear CGMs, for example, continuous glucose monitors. But why is insulin so important to understand?
So glucose, for everyone who's listening, is the amount of sugar, literally, that's floating around in your blood. And your body actually has to have not too much and not too little of that all the time. And your body has this incredible mechanism for keeping it right at the right level that we often don't appreciate. And that mechanism is effectively insulin, which is a hormone. And insulin puts that blood sugar, when it gets too high, back into your cells. And what happens is when we eat too much sugar, when we're too sedentary and we don't have good muscle mass, and so our bodies can't absorb the sugar that we are eating, we get spikes in sugar, and then insulin marches out and puts that sugar away back into our cells. But over time, it loses the fight and it's not able to keep that sugar under control. And people say, well, who cares about that? I need sugar. It's how my brain runs on. It's what my muscles run on. True. However, I liken it to frosted flakes. And when you have too much sugar floating around in your bloodstream, it coats your red blood cells like a frosted flake, and your red blood cells then can't deliver oxygen. And then we get all those downstream problems. And what we know is that insulin irregularities or insulin sensitivity or insensitivity shows up before you see something like a hemoglobin A1C, which is a diabetes measure, but that's measuring how frosted the flakes are. And we don't even want the flakes to get frosted, people. We want to avoid that, right? And so when we're talking about insulin or fasting insulin, by the way, high insulin levels have downstream effects on your sex hormones. When insulin goes up, testosterone gets metabolized into estrogen. These are some of the pathways that really impact women around PCOS, PMS, fertility issues, endometriosis. So a lot of these conditions that we think about hormonally actually start all the way back at insulin, which again is a hormone. And when we think about insulin, or what we were just talking about, Lp(a), which I wasn't trained at Columbia, I also went to Columbia to test for. I trained in functional medicine. We've been testing Lp(a) at Parsley for a decade, also ApoB. When you get ahead of these things, you can start to make changes pretty quickly. And there actually are some ways, for some people, they will be responsive when it comes to Lp(a), others not, and excited about the drugs that are coming. But for something like insulin, you can make real-time decisions in a matter of weeks, couple months, which can start to really turn that ship around. And I also get the question, well, can I defrost the flakes? And the answer is yes. Your red blood cells turn over. The ones that are there now are not going to be the ones that are there in a few months. So if we can shift the way our insulin's operating, we can start to undo some of that damage.
Well, that's a beautiful analogy. I love that.
I mean, it's a bit of a weird analogy, and I truly hope no one out there is actually eating Frosted Flakes. But if you are, this is your message to stop now.
I ate a lot of Frosted Flakes when I was in high school.
I ate a lot of Special K. And I saw something on the Instagram today that was like, do we all remember when Special K was like a diet and the Special K people said to just eat Special K and that was a diet and somehow that was like sort of legitimate in the 80s? And now you're like, what?
I know. People just eating boxes of Special K. And now they're just,
Frosted Flakes are worse.
Frosted Flakes are worse. Yeah. So
sorry.
Yeah, you're in a much better
Cereal
spot
companies.
Than I was. I know. But it's just the reality of the situation. And we'll talk about just some healthy habits and how do we shift. But are there anything else on the kind of the biomarker landscape that you feel like is really important to talk about that you're really excited about?
I think testing in women's health is really important, and women experience a lot of bias in medicine. There's a lot of under-testing of women, a lot of saying, well, live through your fertility issues, live through your PCOS, live through your menopause, and there's nothing we can do about it. And if you're listening to this, there's a lot we can do about all of those things. There is quite a lot of resistance in medicine at large to testing women's hormones. And when we test female hormones, we can take action on them. And I think part of the reason there's the resistance is that there hasn't been the type of training that you get in functional medicine where you actually can intervene through nutrition, through supplements, through lifestyle change, through medications to move the needle on the hormones. So many women benefit from getting a snapshot and a baseline even early, even before they're experiencing problems around testosterone, around changes in progesterone or estrogen, around menstrual cycle, which Whoop does such a great job of tracking. And these insights can take, I think, for women, hormones from this place of, it's my hormones, I don't know what to do about them, to something that we can take action on. And so, we talk about diseases like diabetes and heart disease in the longevity world a lot, right? Understandably, they're the top killers in our population. But I think there's equal measure importance on some of the metrics and biomarkers in longevity when it comes to the things that affect how people feel every day and give them a lot more control. And female hormones are certainly one of them.
I think we already give members a lot of data and lots of trends and, lots of different ways of thinking about and looking at their data, but we also provide a lot of coaching. Now we're introducing another data stream. Just talk a little bit from a clinical perspective, how you think about kind of data and information overwhelm, and how do you manage that with your patients?
Yeah, so it is tricky. I've taken care of a lot of scientists and sort of quantitative people, and they often show up with spreadsheets and, colorful graphs. And, I can never get them into the electronic health record that has their test results. And even at the level of a hospital, just trying to see what medicine somebody was on when they had this this cholesterol readout, they had this inflammation readout on their CRP, they had this, glucose readout. It's frustratingly challenging. Everyone has a different approach to health.
CRP, just for folks so we're not using too many acronyms.
And if you were going to ask, that's another one of mine that I think is a really terrific marker.
Yeah.
So C-reactive protein, it's a protein that was discovered in the context of the bacteria that causes most pneumonia and causes some meningitis. But it's made by the liver. It has a half-life of 19 hours, so it literally changes basically every day. So a really, really great kind of speedometer-style readout of your inflammation level. And inflammation, it's really bad for the blood vessel system, so it impacts heart attacks and strokes. It's bad for the brain, so probably a huge driver of dementia and neurocognitive decline. And I think it's often a signal that there's something more significant wrong when it's even a little bit high.
Yeah. And usually you'll see insulin resistance and CRP levels are very highly correlated.
Yes.
So, we're
definitely a big kind of conversation between the organs there. Yeah. And it also can sometimes be a clue to a smoldering illness, or maybe you just need to suck it up and go to the dentist after 2 or 3 years.
Yep.
But it's a really important kind of signal that something bad is going on.
Yeah.
And on a 30-year time frame matters a lot. But I forgot.
So data overwhelm.
Yeah.
Sorry, I got us off track.
So some people get really freaked out by too much data. And I think that everyone has the capability for this for sure. But, when it's presented the right way and it's handled the right way and people are reminded of how they were feeling before they got that number, most people aren't going to get too freaked out by data unless it's sort of really scary stuff that I'm grateful is frankly not part of the panel. Nobody should open up their labs and see you might have prostate cancer, right?
Yeah.
I think contextualizing it in someone's behaviors and what they're journaling and how they're feeling is the most powerful thing. So I can't do that in the $2 billion EHR system. No offense to the people who bought that or make it. But all of us can do it at home in the app. And like I said, we all are going to care so much more about that. And we're going to be thinking about how do I work on this issue, a little bit all the time when we're making breakfast or brushing our teeth. Wait a minute, here's an idea of how I can move the needle on that insulin marker or get a little bit more sleep or, add some zone 2 cardio this week. So I think that, that context and that picture as presented to the user, the gestalt, the total picture is what's so powerful and so enabling.
I love that. How about what's your perspective, Robin?
I have seen the way that lab data really changes somebody's own understanding of their bodies and motivates them.
So
and one of the luxuries I have in working in functional medicine is our visits are 60 minutes or 30 minutes. We go over all of your lab tests with you, whether they're beautifully visualized or they're stuck in a crappy PDF. We will help you understand, we'll screen share. And a lot of health can feel esoteric, right?
Yeah.
And it's hard to also remember, how did I feel a few months ago? I mean, I know most people can't remember what they had for lunch last week. I can't, let alone what was my level of migraine and joint pain and gut health 6 months ago. And so the data can really help people understand and kind of lock into, well, this is real. And this objective measure then becomes this trackable motivator for people to change their health. And I always think we talk a lot in healthcare at large about how there's no time and we don't have time to spend with people. But I'm this little bit of extra time that we spend in a functional medicine context, not just showing you your data, but helping you understand it and tying it back to you, how you feel and why we're recommending the interventions we're recommending, goes so far in terms of motivating people to actually make changes. And so as this kind of lab data becomes more and more available to people everywhere, we just get to double down on that motivation effect that I think is going to have really important implications for the medical cost curve for people who care about that and for health at large for people who care about their own personal health.
I think too, we're, just given that we're able to merge all of this data into one place, and not to mention we have some of the context with the journaling and we can see what their activities levels are. We can see how much time they're spending in various zones. We'll be able to really help people understand exactly how they need to apply their effort to get themselves into a better place. As a coach, I spent many years trying to get people to do things. Getting humans to do things is hard. How do you both think about just this idea of behavior change and getting people to, because it's one thing to know what to do. Right. And a lot of people, even in the face of some really sobering news, still getting people to resist that bucket of chicken wings can be hard.
Yeah.
How do you think about motivation and behavior change as an individual, maybe just personally, but also with the patients that you work with?
That idea of long-term or a longitudinal relationship really matters, right? A lot of medicine is very episodic and reactive. I feel sick, I come in, I get an answer, I leave, right? And what Whoop has built in is this longitudinal relationship, right? Where you can remind people of something all the time. One of the reasons when I started my practice Parsley a long time ago was that I designed an annual program. And people said, well, why can't I just come once? And I said, well, do you get fit going to the gym once? No. And you also, unfortunately, don't get healthy going to the doctor once either. This is a journey. And so if you can be on that journey with people, I think setting up this idea from the very beginning that this is a journey, this is a path, and we're going to be on it for a while fundamentally changes the nature of motivation. So that's number one.
That. That's beautiful.
And I've seen it. And I've seen it, we've treated almost 50,000 patients. We've really seen it work.
Like we're in this together, and it's just like embracing the idea that this isn't going to happen overnight.
And I'm going to
So
see
let's
you
just-
again.
yeah,
And we're going to
and-
work on this now, and next that we'll work on this, and next we'll work on that. But we're going to start here, but we'll be at the beginning of a path. And then I think the other thing we sometimes forget about is, I don't know what the right word is, but sort of persona or personality. And we talk about it in behavior change research as like finding people's motivation, finding their why. But what I've seen is it goes beyond someone's why. It actually goes to like how they're wired. There's some people who will be given information and make changes, right? They're that type of personality, right? You give them the intel. We see this all the time in my practice. Like, these are the people who won't talk to a health coach if you hang them by your fingernails or by their fingernails. Like, I'm that person as well, so I get it. They just like want the information and then they're going to go do it. Great. But then there's other people who are really motivated actually externally by someone else, a doctor, a coach, their community, someone around them who really wants them to make this change. It could be their friends, it could be their family. And then there's another type of person who's more rebellious, who's sort of like, well, I'll do this if I think it's a good idea. And then you have to kind of convince them it's their idea.
Yeah.
And so I think we don't give enough credit to the fact that we as human beings are all unique in the way that we ingest information and absorb information, but also relate to it on an emotional level, some of which is subconscious. And so as we get to the place where we can give people a lot more data, I think the next layer will be, how do we help you make changes in the way that change is motivating to you?
Just even, the things that we talk about inside these walls, just like the tone, that type of coach that you want, like we kind of have one voice right now, but, the idea that, wow, we could actually talk to you in a way that is personally motivating for you also gets me really excited, because there's so much to, I think, uncover there. To your point, everyone is just really unique in how they receive information, how they want to receive it, and how they're going to apply that change.
Yeah. And it's not always obvious from like the condition or the age. We'll have the same 45-year-old female patient with, perimenopause symptoms, high cholesterol, and weight gain. And those two people, one of them loves their health coach and talks to them all the time. And the other one's like, what health coach? I refuse.
Yeah.
And I think sometimes we forget that dynamic of like who we are as people is really driving a lot of how we relate to some of this info.
Some people don't want to be coached.
They do not.
They just want the information, to your point. Yeah, I think that's such an important perspective. What do you think, Dan?
So I think a huge part of behavior change is also the individualization. So we touched on some of this in how people like to, lead themselves or be led and what they like to get in terms of information. When we think about habits, habits are sort of the emergent properties of our lifestyle. And in the quality world, which I've had a foot in there for a long time, we say that every system produces exactly the results it was perfectly designed to get. So if you sleep 6 hours a night, it's not because every morning you wake up and you say, I'd like to feel this tired again tomorrow. There's probably a lot of factors that land at that number. And so changing habits and changing behaviors and ultimately changing biomarkers and then health outcomes really has to do with customization to somebody's unique, context and needs.
Yeah.
And one of my favorite experiences as a doctor is, being incredibly humbled by people who know their health so much better. And they're almost like, oh, I can't believe I have to explain this to you. And this is most common with a person with type 1 diabetes, because living with type 1 diabetes and having so much data, you become an expert in it, and typically better than almost any doctor. So that combination of feedback and experimentation and curiosity allows people to understand things really well. And so when you enable somebody to do this kind of perfectly, they have a reasonably clear sense of the goals. They've got the right metrics and biomarkers to kind of guide them on their journey, like a compass or a GPS. They figure out these super clever hacks that no healthcare professional would typically offer. I remember one of the first times this guy had lowered his A1C from 8.6 to about 6.0. There's some nuance here. Everybody's A1C comes down, after they sort of get things a little bit better, but not that much. He was just on a little whisper of medicine. I was like, Kenny, how did you do this? So of course he says, oh, doc, I don't want to explain this to you. It's too complicated. And I was like, Kenny, I'm your doctor. I can handle it. But it was all of these little changes he had made. And he hadn't given up anything he really liked. So he didn't give up sandwiches, which you'd think if you have diabetes, maybe you should. He hadn't given up ice cream. again, like maybe you should. He hadn't given up beer, but he had made little changes that added up, and he was giving up enough of the bad part of each lifestyle choice or each habit, but not the thing that really mattered to him. And so when you give people this information in this fun environment to experiment, they always find better solutions than any health professional can find for them. And those are the kinds of things that they can live with for a long time and then become the new habits.
I think that's why Whoop is so sticky, is because it does, I think, elicit, I mean, it's your own data. To your point, Dan, like people love, like they're most curious about themselves, right? And so there's this playground of information that you can, you can get inside and then experiment, and
I think that's a great way of putting it. And, some of the best scientists are little kids because they're not afraid to fail.
Yeah. We're just always coming up with hypotheses and testing them. And
right. Certainly in the healthcare world, there's people who are doing a little too much experimentation and it can be dangerous. But for most of the stuff that we're talking about here, that playground idea is exactly right.
Yeah. And I think as a scientist here at Whoop, I get so excited about the data. We're going to have unprecedented levels of data to be able to put together, I think, what are really novel patterns that have never really been analyzed, So yeah, I'm pretty excited about that. Robin, you have this really good example. I mean, obviously root cause medicine is near and dear to your heart. You have been really, I think, one of the leading voices in helping people understand actually what that means. And you give a great example about just a migraine. You don't have a migraine because it's
because
brilliant.
You have a painkiller deficiency.
Because you have that is so good. So just talk a little bit more about that and just pull that thread as far as you can.
Totally. So when we think about root cause medicine, what we're talking about is treating the true cause of an illness rather than band-aiding the symptom. And it doesn't mean you let someone live in pain. So I'll take our migraine example. Let's give you a painkiller to help you with that migraine. But let's not stop there. Let's also figure out, why are you having migraines?
Right.
Migraines can be triggered by an imbalance in the hormones in the menstrual cycle or how you metabolize your estrogens. Migraines can be triggered in people who are magnesium deficient, which is actually quite common. Migraines can be a result of uncontrolled high blood pressure. They can be a result of, in one of my patients' cases, she had been to headache center, neurologist, gotten Botox, every drug for migraine pain you can imagine. No one had ever asked her what she ate and drank every day. She was drinking 40 ounces of coffee a day.
I had a student athlete, same exact thing. Erin, if you're out there, she migraines, and she was just literally dehydrated.
Yeah.
It was almost like, I can't even believe she had a
severe
little bit of an
dehydration and caffeine
too,
withdrawal and sympathetic autonomic nervous system disarray, the whole thing. We titrated her off of her coffee. Literally, it took a couple months because you can't just go from 40 ounces of coffee today to zero. You'll implode. And her migraines completely went away. It can be chronic stress, right? And so when we take the time to really deep dive into what could be triggering the migraines, when did the migraines start? Was it yesterday or was it 10 years ago? And then in functional medicine, we want to know, well, what happened 10 years ago? Did you lose your job? Did you get a divorce? Were you in a car accident? Did you have a surgery? Did something change around your lifestyle? Did you have an infection? We really go back in time because what came before is often the clue to the story of what's happening today. And then we seek to unravel dairy, actually. I know everyone's talking this week about dairy is healthy for you. And I'm like, high quality dairy can be healthy for you, but if you have an immune response or a sensitivity to dairy where it gives you migraine headaches or acne or asthma or psoriasis or eczema or chronic sinusitis, which I see all the time, then even though dairy can be a healthy food, it's not for you. So back to our migraine example, what we do is we figure out what's causing the migraine so that hopefully you don't have the migraines anymore or you have them far less frequently. And then we don't need that painkiller so much. And when I learned about this form of medicine, it was just like this, I don't know, lightning bolt for me. Like you can't unsee something you've seen. And I was like, I understand in my medical training why I was trained the way I was because that's how the system works. But this is the right medicine. Yeah. And so when we do that, we just fundamentally change the trajectory of somebody's life.
There must be a lot of other examples like that, where people are suffering needlessly. I mean, the migraine example, like, this kid went 2 years with just really severe migraines, and all of a sudden she just drinks water and she's fine.
I mean,
like,
my own story, I developed cystic acne in my 20s, and I went to every dermatologist and esthetician. And
your skin is beautiful, by the way. I can't even imagine that.
Thank you. Well, I've become a bit obsessed with it. But
It is
after this
gorgeous.
experience, I had all the creams and the pills, and they were injecting my zits with cortisone, which left scarring. Terrible thing to do, by the way, everyone. Don't do that. It fundamentally changes the nature of the skin in a somewhat irrevocable way. Antibiotics, birth control pill, you name it. And I then later train in functional medicine, and I learn about food sensitivities, which is a topic that literally never came up in
all of your conversations
my
with
medical
all the
training. Like,
doctors
this
that
is
you
just
met
not
with.
possible. And so, being me, I run the experiment on myself, and I eliminate wheat and dairy from my diet. And a month in, my skin's clearing up. And by 6 weeks, my skin is totally clear. And I was just pissed because I hadn't done this yet when I got married. And I ate a slice of pizza the night before my wedding. And I had totally had a zit the day of my wedding. I'm still pissed about everyone. It's a long time ago. And so I really saw how I had thrown the book at my skin and nothing had worked. And it had really been an inside out job. And so back to root cause medicine, when we look at the body as an ecosystem and we understand what's happening in the gut can be causing what's happening in the brain, or what's showing up in your skin could be starting in the immune system, and we think about the body as ecosystem rather than body as set of organs, we suddenly uncover new solutions that are evidence-based. They're there. They're not, wackadoo or crazy. They're just not the way we were looking at things. And it's just such a powerful unlock for people, from skin issues to migraines, autoimmune disease, fertility. We have so many what I call parsley babies. One of my patients was told she'd never get pregnant without IVF, and she's 3 kids in without assistance. And IVF's amazing, don't get me wrong. But when someone's told that, right, it's being told there's something wrong with you that's irrevocable, and that's just not always true.
Yeah.
And I think there's a really interesting point there too, that, the health system has certain objectives, and those are sort of societally or at a market level important, right? So don't get me wrong. It's important that people get their cancer screenings and don't have heart attacks and stuff, right?
Of course, yes.
But so often people go into the exam room and there's something that actually matters so much more to them. I think acne is a great example, because if you go to the dermatologist with acne, sometimes, and I'm not trying to knock dermatologists, but sometimes I hear from my patients and friends that the derm said, it's not that bad. And they're sitting there suffering, thinking, I'm 35 or 40 or 45. Why do I still have acne? This is supposed to be a teenager's problem. And especially for things like your wedding, it really matters, but it bothers people so much every day. I think that there are a lot of these things, sex and people's reproductive function in so many different dimensions is another thing that people don't get to talk about enough usually. And for many people, it's a huge part of how they feel well. And, we're not going to necessarily solve every problem with the data that we get from wearables and from biomarkers. But I think that this idea that people should be given more of this so that they can have these, safe experiments like you did, which I'm sure that's probably one of the most important things you'd say you've done for your health in sort of the period you've been in. And, imagine if somebody told you couldn't do that because they weren't going to write a prescription for that test or something.
The idea of self-experimentation and living the experiment that you just brought up, I love. And I talk to my patients about that all the time. There's a lot of, especially when it comes to health and wellness, and I think for women, but also for men, this should thing. I should eat better. I should work out. And the second, there's a should anything, it just loses its luster. And in fact, a lot of internal resistance comes up for any of us. And I always tell my patients, live the experiment. Cut out wheat and dairy for 4 to 6 weeks and see what happens to your body. And if your allergies and asthma clear up, you might decide that it's worth continuing to eliminate those foods. And also we can do what we call some gut healing and help you potentially get to a state where you can reintroduce them and not have so many of those symptoms, at least a little bit. Or you might decide, F it, I would rather have allergies and asthma and acne and still eat these foods. But then you're in the driver's seat and you're in control. And I think there's a lot of examples of that where we have a lot more impact on our bodies, on our health than we think. Yeah. And we've kind of given up that agency in various ways to various people. And now I think we're in an era where people are starting to take it back.
I feel that too. I think there still are a lot of folks who are relying on the medical system to do what it's structurally just not set up to do, which is to give agency to the patient. So what do you think from just a structural kind of policy standpoint? Can the healthcare system in the U.S. kind of get to where it needs to be to provide the kind of personalized care that we're talking about here?
I think it can, and I think it has to. I think that the costs of healthcare, we're seeing, premiums are going up this year more than any other year, and that's hitting employers really hard. It's hitting all of us as individuals really hard.
And that's just because we're so damn unhealthy as a population. We're just
we cost so much. And we will spend a few $100,000 on a heart surgery, but we will not spend a dime on meaningful preventive care, or we'll say it takes too long. Technology and AI and empowering people around their data is a piece of that. Like, I don't think it all can be done by our healthcare system. Yeah. I think it's like a and, not an or. Yeah. And I think we have a financial imperative and really a social imperative to invest a lot more upstream in public health. And that's everything from affordable housing and nutrition education and
soup health equity.
A friend of mine has a really cool nonprofit called Eat Real, started in California, that's changing what's served in schools. Like, it's awesome to see this stuff. We need more of that. And I think we need to think about reimbursement and what we reimburse in terms of, hey, we're going to do these tests. We're going to look upstream. We're going to figure out what's going on with you before it's too late. The wave of change will come driven by the consumer. Because I think as all of our collective expectations change around what we want our interactions with the medical system to look and feel like, what we expect our health to look and feel like, that creates this push and this wave along with the financials that together I think will inevitably force our healthcare system to change. And parts of our healthcare system, by the way, don't need to change. I mean, we have an amazing advanced medical treatments and research facilities that should keep doing what they're doing. But in this aspect, we need to change.
Yeah.
I've worked as a complex care doctor and a geriatrician. And I think about the, 78-year-old woman in Quincy, Massachusetts, who I'm talking to her for 20 minutes. And I say, all right, hop up on the exam table. And they hate it when I say it like that. And she, grabs on for dear life to make that treacherous 3-foot journey. That's a person who right now her insurance company is spending $50,000 a year on, everything. And she's not getting a lot that she wants. She's not, ooh, please, can I have more medicine? Ooh, please, I would love to spend 6.5 days in a hospital this year. Could you arrange that? She wants to be able to, pet her dog and see her family members. And I think about that woman, right now I'm in that exam room and I'm thinking, what can I do to keep her from falling this year? And if you go back 30 years, it's very easy. If you go back 10, it's even easy. But so most of where the money in the healthcare system is going into people that cost $50,000 a year and have so much going on. And it's mostly acute care spending. And then I think the next thing is, expensive medicines that, expensive as they are, a lot of them are really good. And if you have the difference between living or dying, or living okay or living terribly, or when we think about what GLP-1 medications and others are doing for people, I do think that that's money that's pretty well spent, but we do need to decide it. To the extent that we can incentivize and enable people to do these experiments that make sense for them, that work for them, that help get them, metabolically healthy, lower risk for heart attacks and strokes, and strong way later into life. And I'm not talking, squatting 415. I'm talking walk from that chair to the table. That's how we save that $50,000 a person much later in life. And, the demographics are really striking how much the population is aging. So we really do have to figure that out.
Yeah.
But I don't think that the answer is robotic exoskeletons for that lady. I think that it's what we're doing right now to help people get a handle on this before disease is so obvious and harder to reverse.
And I love that example you just gave of the 70-year-old lady. My dad is turning 80 this year, and he started weight training this year, and I finally cracked through, and he started a low-dose GLP-1. Dad, if you're listening to this, don't kill me. And he's currently a healthy 80. And I'm like, Dad, I need you around for 20 plus years, in
seriously.
my mind forever. But the point I want to make is it's never too late.
Mm-hmm.
And we can start in longevity really at any age. You can build lean muscle mass. It's harder. You have to eat the protein and you have to do the work, but you can do it. You can start to have some of the metabolic effects, not just the weight loss, but the insulin sensitivity, all of the effects of a GLP-1. I'm less worried about my dad at 80 starting a GLP-1 at a low dose where he's seen tremendous effects from it at a low dose. People call it a microdose. It's just a low dose. But, already then a 40-year-old starting a GLP-1 because I'm like, where are we going with this?
Yeah.
You know what I
You're
mean?
going to be on it for 40
right,
more years.
Which is, I only say that not because I think there's a problem with the drug today. It's just that we haven't seen these types of drugs in action at that length of time.
Right.
But for someone like my dad, I'm like, these interventions can start to have real meaningful impact now. And I think back to our earlier conversation, the healthcare system would do better to recognize that these interventions aren't all a young person's game. They really matter in older ages as well.
How do we get people to care about their health?
You must be one of those Washington policy people. I mean, that is such an important question that I think so many people are thinking about. And I don't think any of the usual answers, make them pay for the cost of their bad choices. I mean, I'm not saying that, there's not any choice in this, but that has never really worked.
Right.
I think a lot of what we're seeing in the excitement around wearables, and I think we alluded to CGMs before, I don't think everyone needs to wear a CGM all the time, but I really love playing with them because of what you learn.
Yeah.
And, when you think about what, functional medicine teaches us about how your body turns calories into a blood sugar number, it is so complicated and there's so much to explore and do there. And I think that, again, not every wearable is for everyone, but I really do like to wire patients up with a lot of stuff. Yeah. And I purposely don't set it up all the way for them because they need to get their hands on the technology too. There's so much to figure out and there's so much challenging in the healthcare system right now, but a lot of it is figuring out the right mix of incentives and tools and systems for people to be able to tinker and play. And I do think that the hardest patient to convince to do something that is like very preventive, in my experience, is a 50-year-old man, okay? Give or take. So when I have that person in the exam room, the thing I'm always struggling with is it's usually a flu shot. I've said this a million times and it always works. I show them the paper that shows that flu shots prevent heart attacks about as well as a statin medication. And they always say, really? All right, I want that. It is a lot about focusing people in, and also they shouldn't, but numbers and pictures really do focus people in and convince them. So I would love it if everyone would just see a sign that says, get enough sleep, enough exercise, not too many refined carbs and processed foods, and like be kind to one another. Yeah. And they would just do it.
Alcohol.
I just did like a sort of expensive epigenomic test, and it basically said that at the end. But when you see the numbers, it does focus you a lot in ways that don't make sense unless you realize that people are irrational and that's how they are.
I actually think that everyone does care about their health. This is actually something that I maybe go against the grain on, but in my medical training, I remember kind of being told that people don't care about their health. And after a few years, I was like, no, they don't care about medicine. They don't care about like the medical system, but they do care about their health. And I think it's how we define health, but I don't know anyone who doesn't want to feel good, look good, be able to do their things that they want to do. As we increasingly get this concept of health outside of medicine and into life, suddenly those dots connect for everybody, and people see what's happening on social media, and they see the products that are in the stores, and maybe they have a product like a Whoop and they're tracking something, but maybe they don't. I think though that the conversation in the past 5 to 10 years has really expanded past medicine to health. And then I think that everyone fundamentally wants to be healthy, and that a lot of people don't know how in their daily life. And that as they start to experiment for themselves, back to the experiment of like, what does that mean? Does it feel good? People do start to make change. And I see it all the time.
Yeah. And I think it really comes down to, I mean, a lot of folks just don't understand. I mean, to your point, as trained as you were, you know, just linking your food sensitivity to your acne, you know, like, I mean, that's a kind of like this really like insane aha moment. People understanding, wow, my short, inconsistent, fragmented sleep is actually contributing to my inability to lose weight and, you know, my ability to move. And so a lot of, I think this project really at the end of the day is being able to kind of help people understand the opportunities that exist for them to advance their health in meaningful ways, you know, and a lot of that comes down to having the right kind of data, you know, to know how to apply your effort.
And you talked about the 50-year-old guy or the proverbial 50-year-old guy. You know, I think we talk about how women bring their partners and bring the men to the doctor. And statistically, that's true. I think sometimes we forget that women go through fertility and childbearing, and that brings them into health and medicine, whether they, you know, want to or not. Meaning wanting to engage in the health or the medicine piece kind of earlier in their lives. You know, 86% of women will have a baby by the end of her childbearing years, at least in the United States at present. And so it's the vast majority. And that to me represents a huge opportunity. I do a ton of work with women around health as relates to fertility, either pre-conception or during pregnancy or postpartum. And it's almost like a lost opportunity in our culture because we focus so much on the pregnancy and the baby. But a lot of the things that make that pregnancy riskier are the health status of mom. And it's like this amazing opportunity. And I'm seeing more and more women at this phase of life, whether they're in their 20s, their 30s, their 40s, right? It's a pretty big range, but kind of see that as this moment to really tap into their health. So that those types of experiences can be a why as well.
I love that you bring that up. And I really hope that that is an area that Whoop can lean into in the future. Before I go down this path of like wanting to have a child, like how can I position myself, put myself in the best possible scenario for my own health to have a healthy pregnancy, but also the future health of my baby? Because I think we're seeing that how healthy the mom is going to have not just an impact on the health of the pregnancy but actually the future health of the child. So they're like, I think the implications are a lot graver in some ways, you know, they're big. So we're going to do some quick hit questions for wrap up. All right. True or false? Data from Whoop Advanced Labs will be more predictive of future health than your annual physical. Robin.
Definitely true. I do a lot of annual physicals. And
Dan coming in hot. I love it.
I don't think they accomplish very much. And when they do, it's usually because the patient brought in some additional points.
Additional data.
I know seatbelts are important. I don't think asking people about seatbelts in 2025, certainly in Boston, Massachusetts, confers that much benefit.
Definitely true, unless your annual physical is with a functional medicine doctor.
Okay,
and then it's a wash.
Right.
Yeah. I think it is a absolute game changer working with functional medicine.
But then you'll bring your Whoop labs to your functional medicine doctor and you'll be one step ahead. So it all works, people.
Okay. If you could only track one metric, cannot wait to see how you answer this. Okay. If you could only track one metric for the rest of your life, what would it be and why?
I'm going to go with total body composition, including bone density, lean muscle mass, and fat mass.
That. Okay.
Yeah.
All right.
Yeah.
Keep going.
Okay. No metric gives us everything. But if you want to think about, I talk to women especially a lot about the brains, bones, and booty era and how if you're going to get to longevity, you got to take care of those three things. And by booty, I mean metabolic health and building lean muscle mass.
But also the glutes.
And also the glutes, which, you know, I have a lot of work to do on. But we are... sort of wasting away as a society, right? And a lot of people are doing a lot to counteract that. But if those things are in good stead, then most likely you are not going to fall over and break a hip because you don't have osteoporosis. You're going to have the strength to get up and do the things you want to do. Metabolically, you're most likely healthy if those numbers are in check. So I think in that one test, you actually learn a lot about other body systems. And we know that there's a lot of implications for state of bones and state of lean muscle mass and certainly fat mass for brain health and dementia. Trying to get an all-in-one. Doesn't totally exist.
That was really convincing.
No, I think that's a great answer.
I know. I don't know
whether we're calling that appendicular lean mass index or grip strength. They say muscle is the organ of longevity. And the more we learn about longevity, the truer that is.
Yeah.
I like to say the best medicine known to man is sleep. The second best is exercise. The third best is estrogen. And the fourth best is Crestor, at least at current state. And so, I do think that that's pretty true. It's a close fight between sleep and exercise. But I do think that sleep is more important because it really does more to preserve and repair. And I think especially when we think about dementia, which is one of the scarier sort of pathways of aging.
Especially too, like when we think about melatonin and human growth hormone, and if we're not getting consistent or insufficient sleep, like those are not consistent and those are not sufficient.
It's true.
Those, the downstream effect of that I think is underappreciated in terms of just our capacity to train and everything that happens during the day.
Right. And you would know this better than me, but certainly when I exercise after a bad night's sleep, it doesn't go that well.
Yeah. Well, your intensity levels, the volume, and we see those data. When you are underslept relative to your baseline, you move less.
So I would probably say, the sleep quality measure, whether we're talking about sort of hours and consistency, that I think is the one thing that I would measure. And I think that, when I ask people in the office how much do they sleep, they usually, it's sort of like how much do you drink or, all
really
these things that people kind of lie about a little bit. So I do think that even though sleep routines do get pretty stable, at least sort of pre-kids, young kids, older kids, after kids, not a ton of fluctuation. I do think that's the thing I would measure.
Okay. You said exercise. And so I really want to be specific here because I think not all types of exercise are created equal. And there's absolutely a taxonomy in terms of what is, I think, going to move the needle the most. What would be your taxonomy? So if we're thinking about, raw strength, functional strength, anaerobic, aerobic, just give me your kind of ranking.
It's kind of like what goes on your plate at a meal. There's a bunch of different groups and you can't get by without, a little bit of everything.
Sure.
I mean, I do really like...
You had to choose.
I do really like VO2 max, and it's something that I check on all my patients, and I think that...
So your upper threshold, zone 5, is your number one thing that you should do.
Yeah. I mean, I think about longevity and planning for it as sort of like planning for retirement. The medical practice that I have around that is called portfolio for exactly that reason.
Cool.
And the idea being that if you know your VO2 max is 50 today, I'm working up to that right now, by the way, you know that if things go well when you're 80, it'll be, sort of in this range. But if it's 35 today, when you're 80, it may not be good at all. And then you may not be able to go up the stairs or something like that. So I do really like VO2 max, this sort
as a measure,
horsepower measure. But if you just have that and don't have certain other things, you still may not feel great.
Right.
Best exercise?
I guess if you were to say, strength training, I think for me, I have this debate in my head all the time. I'd probably put strength training first, just understanding the relationship between, just muscle being a sponge with insulin and, just understanding how that's just the basis of a lot of problems. I guess I'd probably put strength training first if I had to only pick one thing I could do.
I was going to cheat though and say hit training with weights.
Okay, yeah.
And try to combine a bunch
I know.
I did,
it's hard, yeah.
I did one of those the other day. I follow this fitness influencer and she had a workout and I did it and I just about fell over. I was like, I don't even know. But yeah, it's really tough. I mean, it would just have to be a balance of strength training and something like HIIT that gives you intervals so that you
get that heart rate
give yourself that cardiovascular push and then, take care of all of it on the other end with a sauna to round it out.
I love that. I know.
To fake your cardiovascular workout, which is how I think about it.
I know. I definitely am not shy about bolting on a 30-minute sauna session after my cardiovascular work.
Nor am I. And I
it's
do,
such a great little a hack. I don't know.
Yeah.
It's
Plus, my Whoop thinks I'm exercising sometimes because of what it does to my heart rate.
Yep.
I do think it depends so much on where you're at. I talk to a lot of my patients who have excess visceral fat and want to change their body composition about, zone 2 exercise, which people, it's really like the spinach of exercise. Like people don't really appreciate how good it is for you because it's so simple.
Yeah.
Because you don't really have to do that much. You don't have to
No.
drive anywhere. You don't have to have special gear. And in many cases in a hybrid work world, people can even like there's a woman in my neighborhood who is sort of like, I don't know if she thinks of it this way, but she's always walking fast on the phone. I'm like, this lady's got 6 hours of zone 2 every week.
Yeah. Yeah, zone 2 is really powerful. We haven't published these data yet, but there's no question when we look at zone 2, it is actually less exercise and more of a recovery modality. There's something like really positive happening from an autonomic perspective that I think is special. And I think, folks aren't probably tapping into as much as they need to. We know the improvements in mitochondria and fat oxidation, more so for men, I think, than women. I think men get better benefits because women are probably already good. We're already pretty good at those things. So we don't need zone 2 to push us there. But I really think about zone 2 based on our data as more of a recovery modality than an exercise. Yeah.
I'll be curious to see if you all get zone 2 data as relates to mental health, if what you just said is true.
Yes.
Like some sort of like autonomic, sympathetic, parasympathetic reset.
Yeah.
More to come.
Yeah. It would be really cool to see if we can triangulate that data. We probably have the data, actually.
Probably do.
Potentially, yeah. All right, Robin, your longevity is more influenced by your habits than your genetics. Agree or disagree?
Hard agree. Yeah. We have everything, right, is G plus E, genetics plus environment. But so much of what's happening in our health is actually epigenetic, which is the turning on and off of genes in real time by the foods you eat, the pollution you're exposed to, the stress you're under. So in some degree, what happened in utero, which that part you can't control, but there's so much you can control. And I'm actually going to push back against the word habits. I call them core actions because I don't believe that what you eat every day, how you move, how you sleep, any of these things are like a habit. Like to me, a habit is like biting your nails.
They're necessities,
but like sleep,
absolute vital
food,
necessities. Yeah.
Exercise or movement, these are core actions and they're deeply defining to your health.
I 100% agree. I won't say it as eloquently, but I will say that when we talk about the contribution to health, usually people say that on average, genetics is 10%, which is, by the way, approximately the same percentage as the entire $5 trillion a year healthcare system.
Oh.
So, these things do matter. And certainly there are genetic conditions with profound effects on health that are, close to 100%. But for the average person, I would say it's 10%. And, genes aren't destiny. But when we have very little control or engagement with our health, they have a lot more force. Right. Because if you're not thinking about your health, if you're not given the tools to take action, if it's not something that's top of mind to you because you feel okay or you feel meh, but you think meh is normal for age X, genes do play a much bigger role. Yeah. Diabetes is something like 80% heritable, but a lot of that is because people don't have the opportunity to engage with that problem early enough that they could make it less so.
Yeah, well said. Well, this has been such an honor. We at Whoop, if I could just speak for Whoop for a second, we are so thrilled to have both of you working with us to make sure that our Advanced Labs Insight are as dialed and as good as they can be. And we just feel really honored to be able to work with you and call you partners. So thank you.
Thank you.